Next, Professor Dr. Matthias Drossel will speak.
Thank you very much. Thank you very much. I will talk about the connectivity and recognition of degrees in the health professions, especially nursing professions, thinking about a care migration concept and skills and grade mix in Germany and your countries. So if you want to join me on the chat wall, you can do. There is the QR code, so you can write an email address and what do you think about and what you want to tell me, so I can contact you by email, answer you or something like this. Just go there, tweet back DE, ZMD6, or take the QR code, so you can write me a message with your email address so I can answer you. Perhaps you will connect with me to join our program or another joint venture. Yeah, okay. I'm from Hof University and we do an internationalization for about 20 years. So we have about 1,000 students from abroad of totally 4,000 students. So we are on an international way. The most people come from India to Germany, to our university. And we have a satellite center in India, and my colleagues are traveling around all over the world, but not in Egypt, not in Jordania, and so on. So Iraq. So perhaps we will do it in the next years if you will go or you will contact us. We have a master program in nursing. So it's a cross-cultural nursing practice, we call it. It's a Master of Science. And this program is a very important point that we do this program because other ways to get nurses from your countries is very, very difficult. And I think the people have the chance to get another degree and bring the degree back to you with an advanced practice nursing level. We have other degree programs in my department, like innovative healthcare. So we are talking about an innovative healthcare in this program, about robotics, ambient assisted living, and things like this to get a better healthcare system. We have teaching programs for medical and nursing teaching. And we have a program, it's called Smart Society. So we want to build smart cities, so we need people who study this program. Care migration in this one means professional caring. So I go on the next 3 theses I brought with me, starting with the first thesis, we need migration. Yeah, we need migration. Because without migration, we have no chance for our health system to survive, I think. The second thesis of the lecture is that there is not only to have a look for the degrees, we have to look for the differences in the culture. So I will talk a little bit about this. And the third thesis of my lecture is in Germany, they are a little bit afraid to get migrants in nursing, but I think we will benefit at all because the persons who come to us can bring money back to their country. They can bring back home the knowledge they learned at our university. And it's also possible to get a family reunification and other positive benefits of the welfare state of Germany. So I will tell you something about the problem, why we did this program. We have no bachelor or a less bachelor in nursing in Germany. It's vocational training. It's okay, but we see the more complexer the people are ill, and the elderly people, more elderly people. So they have more than one illness, and we have to react on this, and we have to make good programs for people to analyze the situation, to reflect the situation, to be a good practice practitioner with evidence-based knowledge. And this is really a problem in Germany. They can't do this, so they are on the low step, and the medicine is on the high step, and they can't go with the other, position. And there is no specialization in nursing in the most fields of nursing in Germany. We have no progress in the medical field, healing competitions and something like this. We have no nationwide self-administration in the caring sector in Germany, and not on the. I'm from Bavaria, and even though there two, not care migration, not thought through systematically, and there are stigmas, prejudices, and ignorance about care migration. And so I would show you the number of applications per year. This is the data from the number of new applications per year for recognition of credentials as a registered nurse. And you see third states, Bosnia, Herzegovina, other third states, and it is increasing. And it's not on the highest level we think. The peak is coming. Yeah, what are the challenges? The challenges, first, language. We have a big challenge in German language. So if you have patients, you have to talk with them. You have to know all about this. We have big cultural gaps with some countries coming to us. So we have to talk about the cultural gaps. And there are also ethical aspects, because agencies and brokers, we will hear from 2 agencies about that, but it's a little bit, the companies only see to bring them fast in the system. And this is not a good opportunity. I think we have to make a systematically program to learn the language, to learn the culture, and something like this before coming into the company. We have the problem that the WHO said many countries have a problem with nurses at their own. So we have to talk about care drain and care extraction in this country. Is it ethical? Okay. And we have to prepare the persons, because they have to pass a program that they are they get the degree of a 3-year vocational point. Okay. Yeah, we want to avoid the frustrations coming to Germany and be part here. And there is we call it if you care for people in Germany as a nurse, you do it on another way than perhaps in Egypt or something like this. I think you are on a high level in Germany. The nurses do things like bringing the food to the people in a hospital, bringing wash them, clothing or something like this, and all this is what a German nurse does. And you come from a country, you do medical stuff, and then you do this stuff too. It's a big challenge for the people. We need special skills, and you bring the special skills with you. So we introduce a system like in USA or Switzerland or something like this with difference in the grades and their skills. Yeah, and we need this skills and grade mix for as a reaction for the elderly society. We have two parts. One is the culture, one is the degrees. I wrote down two links for you about Germany, how to do Anerkennung to get the degree in Germany, or how to get the degree in Bachelor of Science in Germany. You can have a look at Anerkennungsdatenbank or Anerkennung in Deutschland.de. We have, I don't want to tell you too much about cross-cultural theory, but it's very important to think about how's the power distance index. Hofstede, this is a researcher who told us how to measure the index of this. And there is a power distance index, there is individualism versus collectivism, there is masculinity versus femininity. It's the uncertainty avoidance index, long-term versus short-term orientation, and the indulgence versus the restraint. And I want to tell you something about this. There are some examples for, I think, and some of them are a little bit funny, but some of them are very important to work with another. So, individuality versus collectivism. E.g., in Germany you come on time. In Germany you come 5 minutes before. And I think it's not in every country the same that if you have an appointment, you come 5 minutes before or something like this. Power distance. Yeah, we have no high power distance in Germany. We say we're working on a same level like our together with our chiefs. People coming from India have strong hierarchies. Yeah, I think in your country it's the same. I will look with you in a statistic the next moment. Another understanding of caring and another understanding of medical. So nursing and caring and medical orientation. Understanding of health and illness. Structured planning against short-term orientation. Indirect communication. Germans, they prefer direct communication, but other countries say, yeah, I will do it and I understand, but they don't give other feedback they didn't understand because they think it's not nice to be like this to your chief, yeah, and say, what did you tell me? Or something like this. It's very interesting to go with it. Gender aspects and so on. So it's a very good link, I think, Hofstede Insights. So you can compare different countries about this aspects. And I brought Brazil, India, Vietnam with me. I will show you the ranges. And there you see there is a big difference to our country in blue. And I brought it for you with the countries of Albania, Jordan, and Tunisia. And you see there are big differences too. For example, power distance. Yeah, there is a big gap, and we have to talk about this, and to have to think about it. There are some data not available at all, but it's no problem. I think we see what I want to tell you about this topic. So I think we should talk about the efforts and approaches. So we have to do good intercultural trainings. I think it would be best to make good intercultural trainings in the home country of the people who come to us. We have to have a good welcome management, onboarding process with a warm welcome. Perhaps you talk to German people and they said to you, huh, or okay, yeah. German people in some areas of Germany are not so friendly, smiling, or something like this, like you prefer. But it's not. It's not cool out. No, it's not a cool out. It's their warm welcome to say, okay, passt schon. Yeah. It's their version of being kind. Another part is we need additional path in education, and I think I heard the slideshows before, and I think we can make an exchange. We can talk about this topics, and we can think about to make programs together. We can make an exchange in the lecturing. We can make an exchange with our students or something like this, and so we can learn about each other. And we have to integrate them in the German system if students come to us or people want to work with us in Germany as a nurse or in medicines, but we always have to think about a systematic skill and grade mix in this part. I think we have to clarify the understanding of culture and increase visibility of hidden aspects. I think we have to develop I think we have to develop a real skill and grade mix together. Your skill and grade mix in your country is very good, but in Germany it is bad, it is worse. And we have to talk about this, and we can learn from your country. We have to establish guidelines to do programs like this. We have to establish called skill and grade mix centers, so we can do individual programs for the people where is the deficit, and we can see where's the lack of cultural understanding, doing nursing in Germany or something like this. And we have to appreciate the degree from their country, because it's a frustration for them. They come to Germany, they don't wear the BSc on their name. They go in programs that they get the degree of the vocational program, but not of the academic program. And if you talk to them, they are very tired because of this. And many people go back to their home country or other countries where they can speak German or English, and that's a real problem for Germany. In average, they are for 2 to 3 years only in Germany, and then they go to other countries, and this shows the problem at all. Programs like the two guys will show you work much better, so they can tell you about very good stories, how long people stay in one company, because they do all this I told you before. But I think we have to offer the people also a program on a master level, so on an advanced practice nursing level, so perhaps they will join us. So 3 topics. I think we have to do programs for the people in skills labs, to train them, to bring them into the companies, in the hospitals, in outpatient areas or something like this. We have to do skill and grade mix together, so we have to talk about what the competences, what the skills are they bring with them to Germany, and what competences are in Germany in nursing. And the third one, we have to establish courses like cross-cultural nursing practice, our program with healing competences on a higher level of advanced practice nursing. So we can have a good skill and grade mix, and a good skill and grade mix in nursing means a better outcome for our patients.